Mental illness represents a critical public health concern in the United States, with prevalence rates varying markedly from state to state. The disparities in the prevalence of mental health conditions are influenced by numerous factors, including socioeconomic status, access to care, cultural attitudes toward mental health, and demographic trends. The following narrative examines how states compare regarding the rates of adult individuals experiencing mental illness. Beginning with high prevalence states, West Virginia, Oregon, Utah, Kentucky, and Ohio consistently report the highest percentages of adults with any mental illness, with rates often exceeding 25% of the adult population. Contributing factors in these regions include economic distress, rural isolation, and limited availability of mental health professionals. In these states, comorbid challenges such as substance use disorders and chronic physical illnesses frequently intersect with mental health concerns, exacerbating the overall burden of disease. Conversely, states reporting lower rates of mental illness among adults include New Jersey, Hawaii, Maryland, and Texas, with prevalence rates closer to 16 to 18%. These states often benefit from better funded health systems, greater access to care, and urban environments that may facilitate early intervention and support. However, lower reported rates may also be influenced by underreporting or stigmatization of mental health conditions, particularly in regions where cultural attitudes discourage disclosure. It is also important to consider regional and demographic differences. For instance, rural Southern and Appalachian states tend to experience higher burdens of mental illness compared to more urbanized or affluent Northeastern and West Coast states. Age, race, and educational levels also intersect with geography, influencing patterns of mental health outcomes across the country. Understanding and addressing the complex mosaic of mental health in the United States requires tailored policy interventions, public education campaigns, and improved systems of care that address both prevention and treatment, with a focus on states and populations showing the greatest needs. Tell us in which state you're located now, and please subscribe to our channel. Have a great day.